Understanding Tooth Restoration, a comprehensive guide. Hello and welcome, everyone. Today, we're going to embark on a fascinating journey into the world of tooth restoration. This topic is not just for those who love biology or medicine, but for anyone curious about how dental health professionals help maintain our dazzling smiles. So, whether you've heard this term at the dentist's office or are just curious about it, stay tuned as we unravel the mysteries of tooth restoration together. Tooth restoration, often referred to as dental restoration, is a dental procedure used to restore the integrity, function, and morphology of missing tooth structure. The need for this procedure arises due to external trauma, caries, also known as cavities, or as part of the normal wear and tear. There are two broad categories of tooth restoration: direct and indirect restorations. Direct restorations involve the application of a soft or malleable filling into the tooth and building up the tooth before the material sets hard. On the other hand, indirect restorations involve fabrications outside the mouth using dental impressions of the prepared tooth, which include crowns, bridges, and veneers. In this section, we'll delve into the various types of tooth restoration, helping you understand how each type addresses different dental issues. 2.1 Fillings. Fillings are the most common type of dental restoration. Dentists use fillings to repair a tooth damaged by decay, restoring it to its normal function and shape. Materials used for fillings include gold, porcelain, silver amalgam, or composite resin. 2.2 Crowns. A crown is a tooth-shaped cap that's placed over a tooth to restore its shape, size, strength, and appearance. Crowns are necessary when a tooth is too damaged or decayed to be fixed with a filling. 2.3 Bridges. Dental bridges are used to replace one or more missing teeth. Bridges span the space where the teeth are missing and are cemented to the natural teeth or implants surrounding the empty space. 2.4 Veneers. Veneers are thin, custom-made shells crafted of tooth-colored materials designed to cover the front surface of teeth. They are used to improve your teeth's appearance, masking discolorations or correcting misshapen, undersized teeth. 2.5 Implants. Dental implants are replacement tooth roots. Implants provide a strong foundation for fixed or removable replacement teeth that are made to match your natural teeth. 2.6 Dentures. Dentures are removable appliances that can replace missing teeth and help restore your smile. If you've lost all or some of your natural teeth, whether from gum disease, tooth decay, or injury, replacing missing teeth will benefit your appearance and your health. Consultation and planning. Initially, you'll have a consultation with your dentist, where they assess your oral health and discuss the various treatment options. Preparation. Depending on the type of restoration, your dentist might need to prepare the tooth, which can involve cleaning out any decay or reshaping the tooth. The restoration procedure. This can vary greatly, from simply applying a filling to more complex procedures like implant surgery. Follow-up. Post-procedure care and regular checkups are essential to ensure the longevity of the restoration and overall dental health. Tooth restoration plays a pivotal role in maintaining oral health and ensuring that everyone has a smile they can be proud of. From fillings to implants, various options are available depending on your specific needs. Remember, the key to a successful restoration lies not just in the procedure itself but in the continuous care and maintenance of your oral hygiene. We hope this guide has illuminated the path to understanding tooth restoration better. Keep smiling, and see you in the next video.